Welcome to the webinar. My name is Christy Kaolikai. Thank you for joining us. We are very excited to talk about the Colorado Health Access Fund today. I want to tell you a little bit about my background, and Cindy Willard is going to introduce herself, and then I'm going to share with you Shannon Love's background. I have been with the Denver Foundation since 2015. I came on right as the fund was launching. My background is in social work, so I have a master's degree in clinical social work, and I really enjoy working on the fund and really enjoy working with my team.
Good morning, everyone. It's morning when we're recording, even if it's not when you're listening to this. My name is Cindy Willard. I have been working on the fund as both a contractor and now an employee since its inception. I find this work inspiring and motivating every day, and we're looking forward to hearing about more good work through the upcoming RFP.
And Cindy has some expertise in finances. Do you want to tell us about that?
I've had the chance to work in philanthropy and impact investing for quite some time and really enjoy thinking about the financial models, the sustainability piece, and how to best use resources to support social change.
And Shannon Love, who is the newest member of our team, couldn't be here today, but I want to tell you a little bit about her because you will be interacting with her if you are sending us a proposal. She has a master's degree in social work from DU. Her background is actually in policy, Medicaid policy, and we are very fortunate to have her on the team. Just a quick note about our team. We're all here part-time. We're a total of 2 FTE. So I just want to thank you in advance for your patience if we are slower than usual to get back to you, because this is going to be a very busy season for us. Okay, Cindy.
Great. Our objectives for the webinar today are to share a little bit with you about the Denver Foundation and the Colorado Health Access Fund specifically. We conduct an external evaluation every year, and we will share some findings from that report with you. And we are, of course, going to cover the requests for proposals in detail and provide some frequently asked questions so you'll have a better understanding of how to apply. A little bit about the Denver Foundation and Field of Interest Funds. So the Colorado Health Access Fund is a fund that lives within the broader infrastructure of the Denver Foundation. We know that sometimes the word foundation can be a little bit confusing, and so we want to clarify just briefly here that a foundation can be a fundraising arm of a charitable organization where many different sources and people contribute, but there's sort of one source of those funds. An example of this here locally would be something like the Denver Health Foundation or the Children's Hospital Foundation, where they are actively raising money to support the great work of those organizations, but all of those donations go to one place. Private foundations are somewhat the opposite. They tend to be started by one donor or one family, and so have one source of incoming dollars, but many sources of the use of those funds. The Denver Foundation is a community foundation, which means that we have both many sources of funding as well as many recipients of those funds. And the Field of Interest Fund is really a specific designated pool of money based on the donor's intent. And that is where the Colorado Health Access Fund falls within the Denver Foundation.
Cindy, I have an FAQ for you. It's kind of a twofer. Let's pretend that I work for an organization that's in Aurora and receives grant funding from Basic Human Needs. And similarly, we could also pretend that I am from an organization in Steamboat, and they receive donor-advised funds. Does that prohibit those two organizations from applying and or receiving money from the CHA fund?
The good news is that that does not prevent you from applying to this fund. There are organizations from time to time that are eligible for both Colorado Health Access funding as well as funding through the Denver Foundation focus areas or perhaps a donor-advised fund. Getting a grant from one of those does not preclude you from receiving funding from another part of the foundation.
Great, thanks. So we wanted to talk briefly. I'm not going to read this slide. You can pause it and take a look at it. And obviously this information is also on our website. But our goals are to increase the number of Coloradans that have access to behavioral health care treatment. We obviously want to remove barriers to getting access, and we want to build on innovations and current investments that your community has made. We want to support treatment solutions that will benefit and meet the needs of individuals across the state. And we are also committed to learning from what we do. So we have an external evaluator. We'll share a little bit more about that later. But we share those results publicly, and that's an important value to us. All right, how do we define behavioral health? And is substance use included? Absolutely. We frequently see mental health and substance use. We frequently just say mental health, but we think of the two together. And when we think about who's providing care, the CHA fund is focused mostly on this shortlist. There are probably other providers that could be included here, but these are the folks, licensed professionals that we are focused on.
So a quick FAQ. If an organization is thinking about implementing mindfulness training or yoga for individuals who may have experienced trauma, and thinking about this complementing the work of an LCSW we have on staff, is that a fit for the fund?
That's a great question, and that's a question that we receive pretty often. Mindfulness and yoga are really important bodies of work, and really important bodies of work to healing, but it is not a fit for the fund. Something that's important to understand, particularly when you're thinking about the Denver Foundation, which is mostly focused on the metro region, is that this is a statewide fund. The staff, the donor, and our board of directors are committed to reaching a floor of 20% focus on rural. Right now, we're very proud to say that we are higher than 20% investment with rural populations. Our focus population, if you've gone through our RFP, you'll see it's a very specific population. Individuals need to have an identified behavioral health issue along with being a member of at least one of these populations. I'm not going to walk through this, but I will highlight a few. Persons that are impacted by racial health disparities are very important to the fund. Individuals that are receiving Medicaid or Health First Colorado benefits are important to the fund. Justice involved, and persons that speak a primary language that is other than English.
Couple of questions on our focus populations. Military veterans are not specifically called out on this list. Should they be?
That's a good question. There could be several populations that are not noted on this list. It will be up to you to demonstrate that the population you're serving has an identified behavioral health need and a demonstrated lack of access.
Another question is, if an organization serves people who are leaving correctional facilities, why aren't they called out specifically?
We've kind of highlighted it a little bit in the justice involved, and I know that's a broad category, but yes, make the case that those groups you're serving have an identified behavioral health need and that they lack access to care, and whatever programming you'll be providing will fill that gap.
A little bit about the timeline and funds available. So as we noted, the Colorado Health Access Fund is a field of interest fund that was set up by an anonymous donor. The fund began distributions in 2015 and based on the intent of the donor is looking to wrap up funding in 2022. The initial gift to the fund was $40 million, and this year marks the 8th RFP that the fund has put out.
I have a question for you, Cindy. Let's say my organization received funding during 2 years ago. We're still a grantee. Can my organization reapply to the fund?
Organizations can reapply, but with the caveat that the new application must be for a different body of work or a new program or a new geographic expansion. As you will recall, the fund is interested in increasing access to care. Uh, Due to our limited lifetime as a fund, we are not providing ongoing support for existing programs. We're really looking for expansion and increased access. So if your organization has another program where you can clearly demonstrate an increase in that access to behavioral health treatment, you're welcome to reapply.
Great. We want to talk about our focus areas. They are education, transitions in care, innovation in care delivery, and improved access. Again, we're not going to read the slide, but we wanted to give you a few ideas around what it is that we're looking for. We also want to encourage you to look at our grantee list, which is on our website, and that will give you a lot of insight into what we're looking for. And it's important to understand that your areas most frequently fall into multiple categories, but a few examples are in transitions to care, crisis stabilization services is an important aspect. In innovation, creating or expanding MAT programs in your community are also very important. And I know, Cindy, a frequently asked question comes up for this.
Yeah, so let's talk about a specific example that perhaps could shed some light on it. So if an organization has a full substance use disorder program that includes assisting individuals exiting or entering inpatient care, the program would like to hire an additional LCSW who could offer individual and group treatment, including groups for family members. What categories would this work fall under?
That sounds like a fantastic fit for the fund, and it would fall under all four of these categories.
Great. We wanted to talk a little bit about the different sort of buckets you can apply through. Obviously, project or program funding, many of the examples we've cited so far fall into that. A specific program or project where you are increasing access to that direct care. We've listed a few here. The other option is to apply for capital improvement funding. We are able to support building of new facilities, renovation of existing facilities, again, all through the lens of providing increased access to care.
Okay, Cindy, I have several questions. How about capital campaigns?
The Health Access Fund cannot support a capital campaign in general, but as the capital campaign may contain a component that is behavioral health specific, we could look at funding for that component of an overall project.
How about, does capital include furniture and computers?
Yes, it does, for the behavioral health aspects of the expansion or the build. In other words, if you have a building and an integrated clinic, your request would be focused on the behavioral health offices, the computers for those licensed behavioral health providers, the furniture or equipment that supports that team, not the broader brick and mortar or the entire facility.
Okay, tough question. An organization is expanding their facility, and they would like to include a community room that's going to have all sorts of different activities going on. It might have community training, it will include mental health first aid training, but it's going to be sort of a broad scope of different activities. Is that a fit for the CHA fund?
That type of space is not a fit for the Colorado Health Access Fund. Broad activities or multi-use facilities are not something that the fund is able to support. Again, we're looking for that specific focus on behavioral health, and so would ask you to think about that as you look at your capital projects.
Great, thanks, Cindy. All right, next slide. Funding opportunities. As in the past, CHA is a multi-year grant maker. However, this year, it's only going to be for 2 years, so keep that in mind. The fund, as Cindy talked about,
It's wrapping up.
Is wrapping up, and so we only have 2 years left. Our annual grant awards range from $50,000 to $250,000 annually. Something to note, and it's very important, is that awards can exceed 25% of an organization's annual budget. So please don't send us anything that is beyond that. And we also can't support more than 50% of an expansion project. We have received a fair number of projects that are asking for more than 50%, and and they usually get disqualified. So please take a close look at that in the RFP and keep that in mind.
A couple of questions that we have gotten in the past related to some of the specifics around amounts and applications. If an organization is interested in hiring a provider that has expertise in psychotropics, how do you suggest that this request come in? Should it be a one-year grant to get the position established with billing?
That's a good question, and we receive those kinds of questions a lot. And there are different models, and we do not dictate what that model looks like. We really want the organization to make that proposal theirs and what works best for them. In some cases, it has been a one-year grant, but in most cases, it is a step-down situation. So in other words, CHA may fund that provider's position for year one at 100%. Then in year two, it might be 50%. It really depends on your organization's business model and what sustainability looks like. We do not have hard and fast rules, and we want you to put that in your proposal, whatever is best for your organization.
Great. Another question. Noted on the slide here, the fund will support up to 50% of the program budget. Does this mean that the other 50% has to be matched by another foundation?
Yeah, great question. We know that earned income, frequently Medicaid, doesn't cover all the expenses related to hiring a provider or operating a broader program. So you should have multiple other sources of funding for programming that you are requesting. This includes, but isn't limited to, third-party billing for those of you that have Medicaid clients, in kind. If there's an organizational commitment, that is also helpful, and then other foundations funding is also helpful. Ultimately, we need you to demonstrate that this body of work can be sustained after CHA funding ends. And a tip for everyone, we do not recommend using the fundraising as our sustainability plan model. We do not view fundraising as sustainable for this type of work. Okay, we've mentioned this before, but real quick, organizations can apply to the CHA fund once per year. And active grantees, you can also apply, but it needs to be for a distinctly different population or geographic area. Evaluation of the fund. This is a core value of the foundation and for the CHA fund. As such, we partner with the experts in health in Colorado, and that is Colorado Health Institute. We will be releasing our newest external evaluation report in probably Q1 or Q2 of next year. And it's important to understand that all of our grantees have annual reports that they submit, but they'll also be participating in at least 2 group calls in 2020. And that's to make sure that you have the support that you need from our evaluation team and that you have access to them and understand what the requirements are. All right, moving on. These are the broad strokes of our evaluation. And if you want to take a closer look at our current evaluation form, sort of what you would be submitting every year, it is on our webpage, and I encourage you to take a look at that. But briefly, the framework is called REAIM, and those of you in public health have seen that before. It's reach, effectiveness, adoption, implementation, and maintenance. One of the most important ones to highlight here, something that we've highlighted previously, is maintenance, and that refers to sustainability. And it's very important to us. So some tips on creating a strong application.
Really, the top point is to demonstrate the behavioral health care needs in your community or in the population that you're hoping to support with some data. So looking at national, local, and service level data to help us really understand the need and the gap in services that you're hoping to fill. Being very clear about the increased access, specifically for our focus populations, which we've outlined before, really helpful for us to understand your baseline and then where you think you'll grow from there in increasing that access. Providing for us the rationale for how you've developed both those baseline and increased access numbers makes a very strong proposal.
Let me ask you a question here, Cindy. A lot has changed in Colorado. We have a new governor, relatively new legislature. There are lots of threats at the national level to the safety net. How do you suggest an organization plans for sustainability during such great times of change?
That's a really good question. And we spend a lot of time thinking about this and a lot of time talking with our partners about the sustainability component. Because there are so many moving parts in healthcare, we really try to function from the position of understanding where we are today and using that as our framework. It's impossible to predict what the field will look like in a year or 18 months. And so really thinking about the system now and how you're working within that will give us a sense of your programming. We also really want to understand how the leadership of your organization is engaging in policy and in these conversations around healthcare. We want to understand how you are effective in creating community partnerships and demonstrating your value to your communities. All of these factors help us understand your potential for long-term sustainability.
Great, thank you.
We also want to note just a few of the most common flaws with applications that we see. The top two we've spent some time on, the population fit and really focusing on the sustainability of this expansion after the Colorado Health Access funding comes to an end. If you're unable to demonstrate an actual increase in behavioral health care, that's typically something that will be declined. We also want to be able to understand the positive changes in behavioral health outcomes for clients. So really sharing with us how you understand the results of your work and the difference that you're making in people's lives. We also do not fund planning grants, nor do we mix capital and programming funding together. We have one application for both program requests and capital requests. We do all of our application online. For those of you who have applied in the past, it is the platform that the fund has been using since the beginning. We will have the link to this on our Colorado Health Access Fund website available for you. You do need to register if you have not applied in the past, and we will need to approve that registration. So please allow 48 hours for us to do that. We do our best to turn it around as quickly as we can. But as you're thinking about your timing for applying, please remember that you need to create an account that needs to be approved, and then you need to upload all of your materials.
Something that's really helpful that we've had and received good feedback on is this screening tool. So once you are registered, and again, to reinforce Cindy's message, to do that early, you can go through this screening tool and it will help you decide if it's a good fit or not for your organization. We want you to use your time wisely and your resources wisely. So understanding fit is important. What we'd like you to do related to this, if you have questions for the staff, if you want some feedback, we ask that you send us a summary focusing on population, so the who, the what, are you hiring a provider, are you renovating a building, and then tell us a little bit about how your organization would sustain that. You can email that to us, and the email is cha@denverfoundation.org. We will be happy to give you some feedback, whether it's a fit, what some concerns might be, or if it's just not going to be competitive. And we do that because we want to save you some time.
Quick question on that. If a program as a whole provides screening, some awareness, and mental health first aid, but this is in addition to clinical services, does that disqualify us from applying?
It doesn't disqualify you, but tell us about all the other things you are doing, but come in for the treatment pieces only and make it clear on your budget that those dollars are focused on treatment provision. Okay, just a quick note, I'm not going to go through all of these. The big emphasis on unsupported activities is going to be readiness to implement or planning grants. So sometimes, Cindy mentioned it earlier, we will receive proposals that have 6 months of planning or 3 months of planning. We are looking for organizations that are ready to implement, whether that's building a building or hiring. But take a close look at this. This is in the RFP as well. But please don't submit proposals for anything on this list.
A couple of quick notes. The Denver Foundation as a whole has some parameters around the kinds of organizations or specific criteria that it will not support. The Denver Foundation will not support organizations that discriminate. You can see our anti-discrimination statement on our website, and it's outlined here. And these are both discriminating in terms of policy and practices within your organization. We are unable to fund organizations with a fund balance deficit. We do not contribute to endowments, to general capital campaigns, conferences, or membership fees, and we cannot provide grants to individuals, nor do we do sponsorships or events. The timeline is here. It's also outlined specifically on our website and is in the RFP. The key date here, of course, is Friday, March 6th is when applications are due. You will not be able to wait until that Friday to start your application because of our online process. So please be mindful of the due dates in front of that in terms of content questions, being able to register for our web-based application system, and give yourself plenty of time to prepare your materials, get your online information together, and then come in and be ready to finish your application by Friday, March 6th. Thank you very much for joining us for this webinar today. We hope this has been helpful. We've used some of the questions we've gotten in the past. Please visit our website for all the materials that will help you with your application. And as noted earlier, if you would like to send us a brief description of your programming, please contact us at cha@denverfoundation.org.
Thanks, everyone.
Thank you. Have a wonderful day.